Dr. Mark Stoller, and I'd like to welcome you to Conversations in Primary Care, the role of diet and lifestyle in the management of diabetes, making it work for you and your patient. Joining me today is Davida Kruger, nurse practitioner extraordinaire from Henry Ford Health Systems in Detroit. Welcome, Davida.
Thanks for having me.
My pleasure. And today we're going to have a discussion, and truly a discussion, on how to effectively manage your patients with diabetes beyond pharmacotherapy. So there's really three areas of lifestyle management I want to touch upon today: nutrition, physical activity, and medication adherence. And I think physical activity is the most straightforward of the three, so we'll start with that first. What kind of evidence base do we have that physical activity translates into improved glycemic control?
Well, if we can lower the body weight by just 5 to 10%, the studies will show us that we get rid of a lot of insulin resistance, which makes the body work better. So the insulin that's left in your pancreas, it's there for you. So we know that if we can lower the weight, we also know that physical activity lowers blood glucose and gives you a better chance of lowering your weight as well. So physical activity is the cornerstone. It's the absolute cornerstone to what we're doing with people with diabetes.
And probably is the driver of why we're seeing so much diabetes, although there are many studies that show that exercise alone doesn't lower A1C, and that it's important to integrate the nutritional component. And if you're going to be successful, one of the parameters or things that I tell patients is that your muscle takes up more glucose than any other organ. And so the more lean muscle mass you have, the lower your sugars are. If patients feel they're exercising to lose weight, most of them don't lose weight and then give up the physical activity because they're not losing weight and they hate doing it. And so I make them monitor their postprandial sugars after they've exercised, just to see a positive impact, to get them to feel better about sustaining it. What do you find is the most sustainable exercise recommendation or physical activity recommendation for your patients? What will they do? What can they do that you feel they can sustain?
I think most patients can do either walking, or some people really like swimming. So those are the two that I think, if you have an older individual who is retired and has more time in their life, they can go to the Y, they can go to a gym, they can swim. And a lot of them really like that. There's swim groups, they can get to know people. But walking is really probably the easiest, because you can go to a mall, you can go to a grocery store. In nice weather, you can go in your neighborhood, or you can use a treadmill. So you can walking can be all 4 seasons. It doesn't matter where you live, you can get walking done. And also that has to be incremental. So again, 30 minutes, most people don't have 30 minutes in their life. You can do it 5-minute, 10-minute increments, and at the end of the day say, I've done 30. Or start at 10 minutes, and if you do 10 minutes a day, next week do 15 minutes. But I think walking and swimming tend to be the most sustainable.
And that's the key point, is it's total walk time, not sustained walk time. Is the 10,000 step holy grail valid, or can patients be successful with less?
I think 10,000 steps is a lot. My little Fitbit is yelling at me all day long, get up and move, because most of us don't have those kind of lifestyles. We're sitting at desks, we're working on computers, and 10,000 is a lot. So again, if you can get there, eventually that's marvelous. But I really start patients lower so that they can feel successful. If we could get them to 10,000, I think they're going to see much more benefit to them. But we got to start low, go slow, let them be successful, let them feel successful. And again, I agree with you, it isn't always weight reduction, but it is what else it does to the body and even feeling better.
So let me make it more difficult for you before we go on to the challenge of nutrition. So many of our diabetic patients, because of their weight issues, I've got back issues, I've got knee issues, I've got plantar fasciitis. What kind of physical activity do you recommend for those patients who have limiting orthopedic and neurologic conditions?
Well, those patients do really well on swimming. Those are the patients that often choose swimming if they can. Some of them can do a stationary bike. And also, the pace of walking doesn't have to be, 5-minute miles. It can be 15 or 20-minute miles. So whatever they can do that doesn't stress them out or cause more pain. But a lot of times, swimming is the best answer for somebody who has that many complications.
Of course, I can't swim, but I find
Floating?
I find chair exercises
Yes,
are also very useful
yes,
for patients
yes.
because they can say, well, I can't stand. Well, okay, you can do these sitting down.
Yes.
You always have one more answer than the patient has an
Yeah,
excuse.
and you can do upper body stuff sitting down, which will get your heart rate going as well.
And it's lean muscle mass that matters, and
Yep.
so it doesn't matter how you get there, it's achieving lean muscle mass. I want to thank you for joining us
Thank you
today.
for having me.
It's our pleasure, and I want to thank everyone who's attended today's program. Have a great day.